all of us know we hate nausea, but nausea is kind of a normal thing. For instance, it's common for gals who are pregnant, especially the first trimester, they get a lot of nausea. And then we all have had food poisoning or ate certain things that we ended up vomiting and having a lot of nausea. Those of us in Florida or in the summers, when you overheat, it's so common to get nauseated. So I'm just going to go through some of the common causes that you guys know of nausea and also some uncommon causes. In our office here at Caring Medical in the Hauser Neck Center, we see people who have a lot of nausea and they've already gone to the gastroenterologist or their internist or even an ENT doctor to look for Meniere's disease, or they've had a thorough stomach workout, abdominal workout. Often they've had ultrasounds of the abdomen, endoscopy to look at the stomach, and it all comes back negative. And I'm sure you know through these videos when Hauser's law basically is, Hauser's law is that if you have a symptom that nobody knows the cause of, if you follow the neurology will typically lead to joint instability. And for nausea, the joint instability that it leads to is cervical instability. Cervical instability can screw up the electricity to the stomach or the digestive tract, and of course lead to nausea, and that's what we're gonna talk about. We all know that you can get an awful taste in your mouth, and that can lead to nausea and vomiting. If you eat something, so you eat something and your body's like, no, I don't want this in my system. The vagus nerve will send sensation, those afferent impulses, that's what they're called, to the brain, to the nausea center of the brainstem, which is in the medulla, and it'll start the process of trying to get you to throw up and get that thing out of you. I'm one of those people where if I feel like I need to throw up, I stick my middle finger in the back of my throat and I just throw up. My wife, she hates throwing up, but I know when I feel nauseated and I ate something bad, if I just do that, it gets over, but she has trouble with that. I want to go through how cervical instability causes nausea, but before we do that, we all know that hormone imbalances, like when women have PMS or premenstrual syndrome, there can be a time period where they feel nauseated. In our experience, the cause of that is low progesterone. So if you feel like you have hormonal-based nausea, what I'd recommend is get a blood test on a day when you don't feel good or you feel nauseated, because you want to do tests when you're not feeling good. Food sensitivities. Believe it or not, food sensitivities can have as their etiology cervical instability, because when you have cervical instability and you get vagus nerve degeneration, the vagus nerve doesn't innervate the enteric nervous system or the nerves to the digestive tract, and then the digestive tract, the cells separate a little bit in the digestive tract, so then all of a sudden different food particles, food substrates get exposed in the body, in the digestive tract, specifically the gut-associated lymphoid tissue, and then starts making antibodies and different things against different foods. And that's where a person who all of a sudden has food sensitivities, like they can't eat, let's say all of a sudden they can't eat tomatoes, or their whole life they were fine with bread, now they're terrible with bread, or some other food, you have to think of, well, what changed? And it may be what changed is you developed cervical instability, and that's what's causing the new food sensitivities. Also, if you've seen a holistic practitioner, and you're not eating those foods, but you're really not feeling all that much better, you should look into maybe that you have cervical instability. There's lots of medications, chemotherapy, antibiotics, all kinds of medications that cause nausea. We all know overheating. When the brain gets too hot, one of the things that happens is you get nauseated because the body's trying to get you out of the hot situation and get cooled off. Small intestinal bowel overgrowth, I'm going to talk in a later slide, but that's a common one. That's where you can do tests. Holistic practitioners have different kind of tests like breath tests and stool analysis and different things to check for that. But basically, you have stomach acid. So when you eat food and you have a normal amount of stomach acid, the food gets digested, normally. Also, think about this. You got Chinese food, you keep it in the refrigerator. Now it's like the second or third day and you're wondering, should I eat this? Let's just say there's a little bacteria in there. If you have the normal amount of stomach acid, when you eat that Chinese food, the stomach acid should kill those bacteria. But when you have cervical instability causing vagus nerve damage, the vagus nerve is what stimulates your body to make stomach acid. So then your stomach acid count is low. So again, you're more likely to get bacterial overgrowth or bacteria in your food to get through to the small intestine. Now, the other way that bacteria gets into the small intestine is through the colon. So the small intestine in general isn't supposed to have a lot of bacteria because the small intestine's job is the place where food is absorbed. The stomach breaks the food down, the small intestine absorbs the food, and then the colon all the substances in your food that aren't crucial for your survival, those are called waste products, and those waste products then go out your anus, and that's what stool is. There is a lot of bacteria in the large intestine, and there's a valve called the ileocecal valve. That's supposed to stay closed and not let large intestine contents go into the small intestine. So when you have cervical instability leading to vagus nerve degeneration, especially on the right side, which in our office we would show by your vagus nerve being very small on the right side. The ileocecal valve can open when it shouldn't open, so the contents of the large intestine can get in the small intestine. And that's what I think is the cause of small intestinal bowel overgrowth that won't get better by herbal substances and changing your diet. And we all know that gallbladder disease, right? If you have a gallstone, that can lead to nausea. What a lot of people are unaware that gastroparesis or decreased contractility of the stomach can have as its root cause cervical instability. So cervical instability can cause nausea by increased tension on the medulla nausea center. So here, you see here, this hole here, this is the foramen magnum, this is the atlas, the top vertebrae. The medulla is the extension of the spinal cord, then there's the medulla, then there's the pons, then the midbrain, then the brain. So the relay center from the body before it gets to the brain is called the brain stem, and the first part of the brain stem is the medulla, and that's where the nausea center is. So you can imagine if somebody has cervical instability, that's going to kink any nerve tissue that's at the cranial cervical junction. So that can be a cause of nausea. Then when the pressure inside the brain gets high, and so the most common cause we see for increased brain pressure is kinking of the jugular veins by instability of the atlas. So the atlas can kink the vertebral artery right before it gets into the brain. So what happens is if the jugular vein is compressed, the brain has trouble draining the fluid. And when there's extra fluid in the brain, that increases the brain pressure. And one of the symptoms that a person gets is nausea. So if you have nausea that seems to be there all the time, and even when you lay down, it gets a little bit better, but not all the way better, you really should get an assessment for upper cervical instability and test for increased brain pressure. When you feel fine when you're laying down and you get up and you just feel terrible nausea, that can be a sign of a cerebral spinal fluid leak. And typically, to diagnose that, you need to get a CT myelogram. That's normally, and the myelogram is done when you're on your side or you're on your stomach. Most cerebral spinal fluid leaks occur at the cervical thoracic junction. That's normally where the leaks are. We talked about cervical vagopathy, and cervical vagopathy can also cause POTS or terrible nausea, when you're sitting up. And this is a little bit more detail. So somebody who has nausea, but they also have other signs and symptoms of cervical instability, such as clicking, popping, grinding in the neck with neck motions, real severe tension, especially where the head meets the cervical spine, and other symptoms of cervical instability, such as light sensitivity, dizziness, vomiting, muscle spasms. It's probable the nausea is actually coming from the cervical instability. This slide is very detailed, but it really does show how ligamentous cervical instability can kink the brain stem, so that irritates the nausea center, giving nausea. If you have vagopathy or a decrease in the number of vagus nerve cells, it can cause gastroparesis, or the stomach doesn't work. The stomach doesn't make stomach acid. The food doesn't get digested, so the food just sits in there, and when the food just sits into your stomach, you're going to get nauseated. Decreased stomach acid secretion because of this causes nausea. When you have increased intracranial pressure or brain pressure, or if you have looseness of your atlas, that can block the cerebral spinal fluid that surrounds the spinal cord, and that can also increase brain pressure. When you have increased brain pressure, not only can you get nausea, but it can induce the symptoms of things such as Meniere's disease. So if you've been diagnosed with Meniere's disease and nobody knows the cause, it could be that the extra cerebral spinal fluid is going around the 8th cranial nerve, the nerve that has to do with balance and hearing, and that's actually what's causing your Meniere's disease. So the treatment, of course, is going to be to correct the cervical curve and receive prolotherapy to the ligaments that are injured that are causing the ligamentous cervical instability. When your eustachian tube doesn't open or close properly, so the eustachian tube goes from the ear to the throat. So when that doesn't open or close properly, the fluid accumulates in the ear, and of course that can cause dizziness, nausea, and things like that. When you have ligamentous cervical instability, your blood pressure sensor can be off, your reflexes that have to do with balance. So imagine if your body had trouble knowing in 3D space where your head was, you can get the sensation as if there's a rocking motion, or you're on a boat, or you see 2, 3, 4, 5 images. I had a patient the other day, it was a new patient, and on the board in the room, it didn't say that she had blurriness of vision or double vision. And basically, her optic nerve sheaths were so big. Like, in other words, there was so much fluid on her eye nerve. I said to her, I go, Janice, normally you have blurry vision or double vision with this. And she's like, Doc, I see 5 of yous. So For those of you who like what I look like, that's good, but imagine seeing 5 of yous or everything she saw was blurry. You know that's going to give you nausea, like you're just going to feel. So gaze instability. Gaze instability meaning you're not seeing exactly the same image on your right eye and your left eye because of the changes in the eye nerve from cervical instability can give you terrible, terrible nausea. So these are some of the mechanisms, like I said, that can cause small intestinal bacterial overgrowth that cause nausea. So cervical instability can cause the pyloric valve, which is what separates the small intestine from the stomach. So somebody who has been diagnosed with pyloric valve problems or pyloric stenosis, you should consider getting an evaluation for cervical instability because that could be the cause. Low production of stomach acid. So if you find you have to take betaine hydrochloride or you can only eat a really little bit of food or you're losing a lot of weight, you need to get an assessment for cervical instability because that could be the reason why the vagus nerve isn't stimulating your stomach to have stomach acid. When the stomach doesn't contract normally, gastroparesis, that can cause nausea. When the small intestine, somebody who's horribly constipated, like it's almost like they can't have a bowel movement without taking a bunch of X-Lax or different kind of medications to have a bowel movement, you probably have small intestine dysmotility. In other words, the electrical supply to the small intestine is getting inhibited, and that's leading to, not just constipation, but can lead to nausea. And even the large intestine, the same thing. The sphincter of Oddi, so some people have spasms in the various sphincters that go from the gallbladder and the liver, or somebody has recurrent gallstones and they don't know the cause. Sometimes the cause can be vagus nerve dysfunction from cervical instability. I put this up here. Well, just before we do that, this is a jugular vein that's getting compressed here. See all these veins coming from the back of the neck? Those are called emissary veins. So the bigger your emissary veins are, the more likely it is that you have jugular vein compression from something involved in your neck. So that's just a point I want to make. And this is what an enlarged eye nerve looks like under ultrasound. So normal's like 5 millimeters. This one's double the size, 10.2. So that's an elevation of the optic nerve sheath. So now let's go back to this study. So this is the study. It was basically evaluation of MRI findings in patients with idiopathic intracranial hypertension after venous sinus stenting. So there's some people that have stenosis of the veins in the brain. So these researchers were looking at, did any of the tests that they do correlate with symptoms, and were the symptoms better after the brain pressure went down? So 2 of the significant findings were that when they decreased the occipital emissary vein diameter, the headache frequency decreased. Because a lot of you have head pressure, not just nausea, but just head pressure. So it's likely that you have some kind of a vein, and the most common vein that gets compressed is the jugular vein. The fluid has trouble going into the jugular veins from the brain, so it goes in these emissary veins. And these researchers found that once they stented the vein that was compressed, the emissary vein diameter went down, meaning the fluid wasn't getting diverted there, and the headache frequency went down. And there was a strong correlation observed between decreasing optic nerve sheath diameter and improving nausea and vomiting. So meaning that once the veins were open and the brain could drain, so the fluid didn't go around the eye nerve. So if you wonder, geez, why does Dr. Hauser and Caring Medical, they make me do all these tests, do all these tests when somebody is to be a new patient? Well, we need to find out why exactly a person has symptoms and what are the abnormalities in the neck causing. So one of the significant abnormalities that it causes is fluid. You could see that this is twice as big as this. This is twice as big as this. So this eye nerve has so much fluid around it. It has like 4 or 5 millimeters of fluid. So when the vein was stented and the fluid flow out of the brain got back to normal, the eye nerve sheath, instead of being this big, it got to this big, right? Because there's not extra fluid smashing on the eye nerve. And that correlated with an improvement of the nausea. So we use the neck vital testing, such as optic nerve sheath diameter, not just for diagnosis that there's a reason for a person having blurry vision or seeing 5 of Me's, but also we can monitor whether the changes that are occurring in a person's neck are changing the physiology in their body, such as the fluid around the eye nerve is going down, and that then correlates with different symptoms improving. So if you have nausea and nobody can find the cause, I'd really encourage you to get an evaluation for cervical instability, and if that's found, the way we treat it here at Caring Medical is we do cervical curve correction and prolotherapy. Thank you for watching.